So TB septic arthritis makes up about 1 to 3% of all TB cases and 10 to 15% of extrapulmonary tuberculosis. Spine TB is the most common site of skeletal TB. This is followed by large weight-bearing joints such as knees and hips. Wrist TB has been reported, however, often found in patients with rheumatologic disease such as lupus or rheumatoid arthritis, as well as in patients who are immunosuppressive therapy like on mycophenolate or infliximab. The diagnosis of TB arthritis is almost always delayed, with delays in diagnosis recorded up to 2.5 years in Saudi Arabia. Most patients present with chronic joint pain that is unresponsive to routine treatment like NSAIDs and steroid injections. Interestingly, a history of trauma to the joint is very common. If the arthritis has been present for more than 6 months, frequently both passive and active range of motion are restricted. Uncommonly, there's a painless cold abscess of the joint site. This has also been reported. Constitutional symptoms are present in only 20% of patients and are intermittent. For the most part, majority of these patients present without any fevers or night sweats or weight loss. A chest x-ray, if obtained, is almost always normal, as concomitant pulmonary tuberculosis is uncommon. Patients with TB have hypersensitivity phenomenon as well. So you can find a patient with monoarthritis that also has erythema nodosum, which is these hard, painful nodules that are erythematous, that are usually found on the shins, such as in patients with sarcoidosis. They can have episcleritis, uveitis, which is inflammation of the anterior chamber, as well as Ponson's arthritis, which is a TB reactive polyarthritis that tends to affect the small joints, such as the hands and feet. As TB arthritis typically doesn't elicit a systemic inflammatory response, there's typically no change in the white blood cell count, and ESR and CRP are often normal. As a result, despite presence of joint effusion and loss of function, arthrocentesis, if you aspirate the joint, is often not persuasive for an infectious arthritis, and the results will often look as though somebody has degenerative joint disease.